Endometriosis symptoms bring a lot of pain, agony, and distress. In fact, excessive period cramps or dysmenorrhea is one of the first signs of endometriosis. It is a growing concern of poor mental health, infertility, and absenteeism amongst women, specifically during menstruation. While we are still trying to figure out the causes and treatment of endometriosis, one thing that you should know is early intervention helps. This is because endometriosis is progressive in nature. That means you need to know and address the symptoms of endometriosis at an early stage. This will not only help you to stop the progression of endometrial tissues in your body, but also help you to find relief from most painful symptoms of endometriosis. Hi, this is Nidhi Bansal here from Medhya Herbals. We help women to gain health with all natural and holistic principles of Ayurveda. And in this video, we will go through the causes and symptoms of endometriosis. We will also look into some of the treatment options that currently are being offered for endometriosis and why you should go for natural treatment that Ayurveda offers. Let's get started. The first signs and symptoms of endometriosis are not always the same for everybody. This is because it depends on the growth and location of endometrial tissues in your body. That's why some women experience high intensity symptoms, while for others there may not be any noticeable changes. Yet here are some of the common symptoms and signs of endometriosis which are experienced by majority of the women. So number one is pain. High intensity pain in your back, in your abdomen, or in your pelvic area during menstruation, during elimination is an indicator of inflammation and blockage, which often comes with endometriosis. Growth of endometrial tissues leads to a lot of pain and cramping in the pelvic cavity. This pain usually radiates from the lower back to the lower abdomen and may also progress to your thighs and other body parts. The pain of endometriosis usually progresses along with the growth of endometrial tissues. That's why if you are experiencing pain that is progressive in nature or that is becoming intense with subsequent periods, then you should consult your doctor to check the presence of endometrial tissues in your body. The second symptom of endometriosis is also poor digestive health. You may be experiencing excessive gas, bloating, indigestion, or episodes of diarrhea and constipation, which also indicate inflammation in your gut. These digestive symptoms become aggravated before and during your menstruation because there is increased activity in your pelvic area during menstruation. Now, the third symptom of endometriosis is irregular and painful periods. Periods that don't come on time, and when they come, they bring a lot of pain or may bring excessive bleeding is sure a telltale sign of endometriosis. While this is common for endometriosis, it may also occur in other health cases such as PCOS and hormone imbalances. That's why you need to check if you are experiencing subsequent episodes of heavy bleeding, painful periods, heavy cramping, and short menstrual cycle or menstruation that doesn't stop for a long time. The fourth symptom of endometriosis is infertility and inability to conceive even after trying multiple times. This is because endometriosis arises as a result of irregular ovulation or absent ovulation, which leads to irregular periods in the first place. As a result, you struggle with subfertility or infertility. The real cause of endometriosis is not certain yet. There are multiple theories around retrograde menstruation, such as backflow of menstrual flow, genetics, inflammation, or presence of endometrial tissues at birth. Now, beyond all of these theories, one thing that is common in all of these explanations is presence of inflammation in the body, which may be as a result of genetics, or it may be triggered due to poor diet, lifestyle choices, or as a result of excessive exposure to chemicals or stress. Now let's look into how and why of the growth of endometrial tissues in your body. So the theory around retrograde menstruation begins with the backflow of menstruation that is happening as a result of inflammation in your body or as a result of Vata-Dosh imbalance, as we say in Ayurveda. When there is backflow due to Apan Vayu imbalance, then that leads to the flow of endometrial tissues in the fallopian tube, and they may enter the abdominal cavity from there, and they may attach to the abdominal cavity organ, such as the outer line of the uterus or around the abdominal cavity tissues, and they may also progress to other body parts through your lymphatic and through your circulatory system. This leads to the growth and spread of the endometrial tissues in your body till as far as parts of your head and in other parts of your body. Now, the second factor which is present here apart from retrograde menstruation is poor functioning of your immune system. Now, when there is presence of abnormal tissues such as the endometrial tissues outside of the uterus, then your immune system should normally be able to take out these cells and destroy them at the right time. However, when your immune system is not functioning as it should, it is not able to destroy these cells, and as a result of which they start to grow unabated. They may grow like the normal endometrial tissues in different body parts, creating a lot of pain, excessive bleeding, uneasiness, and symptoms of more inflammation in the body. Now, when we look into why your immune system is not functioning as it should, the real cause behind that is the inflammation. The inflammation might be happening as a result of your diet, lifestyle, stress, or exposure to certain chemicals such as the endocrine disrupting chemicals. Now, the third factor that is happening here and that is supporting the growth of endometrial tissues is hormone imbalances, specifically high estrogen in your body. When that is happening, then high estrogen in your body actually pushes the growth of these endometrial tissues. Estrogen is required for the growth of endometrial lining in your uterus in the luteal phase of your cycle. When estrogen is high in your body, then that further pushes the growth of these endometrial tissues outside of the lining. That's why with each cycle, the pain becomes even more, specifically during the luteal phase. So you see, it is the presence of multiple factors which are all pointing towards increased inflammation and imbalances in your body, which is creating conditions like presence of endometrial tissues and also progression of endometrial tissues and leading to the painful symptoms that you are struggling with. Endometriosis is progressive in nature. That means if no changes are made to your diet, lifestyle, or no proper treatment is taken, then the growth and spread of endometrial tissues will keep happening as it is. According to American Society of Reproduction, there are 4 stages of endometriosis according to the severity of the symptoms. Now let's look into all these 4 stages and understand what kind of symptoms you may be struggling with and what stage of endometriosis you may be on. The first stage is the minimal stage at which the implants are superficial in nature. That means they haven't really attached or grown in any particular area. This is really an early stage at which one can prevent the implants from sticking and growing at one place. The second stage is the mild stage at which the growth and planting of endometrial tissues has started to take place. These implants may have been placed at deeper level at one site, or they may be present at multiple sites. The third stage is the moderate stage at which you may start showing signs of endometriosis apart from pain. At this stage, the implants have started to grow deeper and spread further in your body. They may have already gone beyond the pelvic cavity and maybe in the abdominal cavity and further parts of your body. The fourth stage is the severe stage at which you are explicitly showing symptoms of endometriosis and the growth and spread of implants has gone further and deeper. There may be large endometrial tissues on one or both of the ovaries as well. One may experience many dense adhesions. It may also happen that the adhesions are interfering with the normal functioning of your digestive system organs in your abdominal cavity. As a result, you start experiencing symptoms of poor digestion, lot of pain, stickiness, heaviness in your body. Endometrial tissues can grow and spread to different parts of your body, as a result of which the intensity and the type of symptoms vary in different women. Here are the sites that are typically reported in endometriosis cases. They may spread and go beyond the uterine lining. That's the first condition of endometriosis. They may be in your abdominal cavity, in the pelvic cavity, attached to different reproductive organs. They may go under your skin, in your lungs, and the head, or affect the functioning of the urinary system, such as the urinary bladder, kidneys, and the ureters. Now, if we look into the group of women who are prone to develop endometriosis, then one factor that we find common is the presence of inflammation, either due to existing conditions such as PCOS, hormonal imbalances such as high estrogen, or autoimmune conditions. You may also be prone to endometriosis as a result of genetics or due to exposure to chemicals, as we discussed earlier. It may also happen as a result of certain medications that you may be taking, or as a result of the hormonal contraceptives, because they further disturb the normal function of your reproductive system. You may also be prone to develop endometriosis if you have long cycles of menstruation or shorter menstrual cycle. That means if you are already struggling with heavy bleeding, then there is high chance that there may be backflow, which can result in the presence of endometrial tissues in different body parts of your body, specifically if your immune system is also weak, which is mostly the case. The growth and spread of endometrial tissues not just brings a lot of pain, but it also leads to a lot of health complexities as a result of disturbance in normal functioning of the body. If endometriosis is not controlled at an early stage, you may be prone to several health risks such as infertility. Some of the other health complexities that may happen as a result of endometriosis are presence of tumor, emotional distress, and sticky adhesions in your body. Endometrial tissues may also spread further and far in different body parts, and it will be really hard to take them out at a later stage. There is no cure for endometriosis in modern medicine. Your treatment line really depends on the severity of endometriosis or the specific symptoms for which you got the diagnosis. The endometrial tissues may either be removed surgically, or you may be prescribed synthetic hormones to treat certain symptoms such as infertility or irregular periods. Unfortunately, all of these treatment options provide only patchwork solution, and sometimes there is relapse of endometrial tissues in surgery. It has been observed that for as many as 28% of women, there is a relapse after 18 months of surgery, and there is higher probability of relapse as the time goes on. That's why it is important you look for the treatment of endometriosis from a holistic and natural way. You should try to address the root cause of endometriosis, which is inflammation, as we just saw. You should look to adopt a healthy diet, lifestyle, and remove all the root causes that have triggered endometriosis in your specific case. And Ayurveda offers you solution just like that. It not only addresses your specific symptoms, but also helps you to address endometriosis at the root cause level by adopting right diet, lifestyle, and with the support of Ayurvedic herbs that will help you to reduce inflammation and fight the root cause of the disease in the first place. Endometriosis can be treated and its progression can be stopped with all natural and holistic treatment options of Ayurveda. Suitable regimen for diet, lifestyle, and herbal therapies is prescribed according to your specific symptoms and according to the imbalances that are present in your body. In my next video, I will share with you Ayurvedic treatment options for endometriosis and how you can adopt a healthy regimen of diet and lifestyle to support your health even in the presence of endometriosis. Thus, it will help you to stop the progression of endometrial tissues in your body. So that was all for now. I hope you found it useful. Do leave your comments, feedback, and suggestion, and I'll get back to you. I will see you soon. Until then, bye.